Hi, good afternoon, everyone. I'm Dr. Akhila, consultant fertility specialist, Sudha Hospitals, Banjara Hills, Hyderabad. Today, we are going to talk about lifestyle and fertility. So, what we should do, what we should avoid, how we should behave, what should we eat to be able to get a pregnancy naturally. So, the health of the woman and her partner influence directly the health of the baby. This we must understand. So, basically, to improve the baseline health is important to be able to get pregnant. Now, fertility is not just a woman's problem, it is a couple's problem. So, the man and the woman both have to be able to modify their lifestyles in order to get a pregnancy naturally. So, let's quickly start with what we should do to get this pregnancy naturally. First thing is the weight. So, we need to keep our weight optimum. A BMI of 18 to 24 is what we are looking at, and underweight or overweight, obesity, all these can cause fertility problems. So, how to control our weight is by regular moderate exercise, which should be daily, and it should be moderate, like brisk walking or badminton or outdoor activities such way. It shouldn't be too rigorous. Obviously, sedentary lifestyle is not something we're looking at. Now, coming to diet, healthy diet is something we all tell, but what includes a healthy diet is taking fruits and vegetables. Thoroughly washing the fruits and vegetables before consumption is very important, including nuts. Pumpkin seeds have a lot of zinc that helps in fertility, and avoiding processed food, trans fats like pastries, burgers, all this can be helpful in trying to eat a healthy, balanced diet. And including high protein diet, high fiber diet also helps. These are some of the things that are a part of a healthy diet. Avoiding alcohol, quitting smoking. What we must understand is 1 cigarette per day increases the risk of miscarriage by almost 1%. So, quitting smoking is a must. It's not just for women but also in males, because it can lead to decrease in sperm counts and mortality. And coffee also, about 2 cups of coffee is what we're looking at, that can be consumed on a daily basis. uh, Stress. Stress is an important factor that impairs fertility and also the general well-being. So how do we decrease the stress is by doing yoga, certain asanas, and meditation. That is, keeping the brain still and peaceful helps in regulating the hormones and thus helps in fertility. Also, taking some multivitamins helps, like folic acids, coenzyme Q, vitamin C, vitamin E, and vitamin D in those patients who are deficient helps in fertility. Um, Certain vaccines, which are live vaccines, we need to avoid these when we plan a pregnancy. Suppose if you have to take one of these live vaccines, or rubella or any other vaccine, a gap of at least 1 or 2 months is advised before you plan for a pregnancy. Treatment of infections is of paramount importance. Pelvic inflammatory diseases, sexually transmitted diseases, chlamydias, vaginal candidiasis, all this can cause infertility. When these infections are treated, the chance that you may naturally get pregnant becomes higher. Certain occupations also cause fertility issues, like standing for a prolonged period of time, night shifts. All this can cause disruption in the hormones and therefore leads to fertility issues. Working in industries with pesticides, insecticides, and other occupational hazards also can cause fertility issues. So these things need to be checked. And before planning pregnancy, pre pregnancy planning is important. And what includes in that is a little bit of weight loss. That is, we are not looking at 20 kgs or 30 kgs or of weight loss. All it requires is just about at least 5% of weight loss is what we are looking at. Also, keeping the sugars, the thyroid, prolactin within normal range, in control, helps in pregnancy. And treatment of these infections that I mentioned also helps. These are some of the things that we need to look into before you try for a pregnancy naturally. There are some things called as endocrine disrupting chemicals. So almost about 1,000 chemicals are added each year, and none of these are, or maybe most of them are not tested for its effect on fertility. So there are these chemicals that come under endocrine disrupting chemicals. So as it suggests, these chemicals have a negative effect on fertility because they mimic or alter the natural hormones that are in the body. So these are some of the things that we must avoid to be able to remain fertile and achieve this pregnancy naturally. And most of our insecticides, pesticides, certain cosmetics that we use, the cleaning, the cleansers to clean the surfaces, all this can have these, the plastics that we use can have these endocrine disrupting chemicals, EDCs. So it is vital that we identify these and stop using these, because most of them are not really tested for its effect on fertility. What are the simple ways that we can identify, or what do we do to identify this and try to avoid? So number one, if on the label you're not able to read certain ingredients or chemicals that are there, those kind of products that you can't pronounce, you can't read, better to not buy them. The second most important thing is to go organic. That is, the lesser distance your food travels, the less chance that it has chemicals in it. So go organic, and that is a safe way to consume good food. Also, washing your fruits and vegetables thoroughly. The other thing is, there are the bottles that we use for drinking water. It's better to not use plastics, to use bottles in metal containers or glass bottles. These are really helpful. And when we microwave, there are utensils that are labeled as microwave safe. So use these containers to microwave food or other things. And we can use even home cleansers like lemon and vinegar to clean surfaces instead of using the uh, chemicals that we get outside, which can cause fertility issues. To use essential oils for room fresheners or air fresheners. All this can be taken care of to be able to lead a healthy lifestyle. And a healthy lifestyle not only helps in fertility, but it also has a profound impact on the general well being and the general health. So, these are some of the tips that I've given on how to achieve a pregnancy naturally, how our environment has an effect on fertility. Thank you. So, there is a question: what are all the day to day lifestyle changes to improve fertility? So, number one, regular exercise. That is very, very important. Moderate exercise like brisk walking is what we're looking at. Healthy diet, including fruits, vegetables, nuts, helps in fertility. And these are the two most important things that we should be able to do to be on a day to day basis. What are the common common lifestyle factors affecting fertility. Like I have already explained, some of the common lifestyle factors like alcohol, consuming alcohol, or smoking, even coffee more than 2 cups per day, all this can cause fertility issues. Eating processed food, eating trans fats like burgers, pizzas, all this has a negative impact on fertility. And not sedentary lifestyle, the night shifts, prolonged working hours, these are the things that can cause fertility issues. I think, should I completely avoid junk food? Um, Better to avoid, definitely, and especially if you're planning for fertility, all the more. Junk food, you can make the same junk food at home as well. You can make homemade pizzas, homemade noodles that are much healthier instead of processed food or canned food. These type of things is something that we need to avoid. Homemade pizzas, all those are quite healthy. Does prolonged sitting affect fertility? What should be done to fix it? Yes, prolonged sitting, prolonged working hours leads to increase in stress. It adds on to your sedentary lifestyle. Uh, these should be avoided, which means in between you can take a break and walk around and come back. Do yoga and meditation to be a little stress free. A regular exercise, even if it means about 10-15 minutes of brisk walking, will keep you active, healthy. These are some of the things that you should inculcate. What is the healthiest amount of screen time to maintain healthy fertility? So the screen time, like the TVs and the DVDs, these come under some unavoidable things, so they do have certain effects on fertility, but the adequate screen time, maybe you can put it as about maybe half an hour or 1 hour per day, but these are the things that are unavoidable. So the endocrine disrupting chemicals that we are talking about, some of them are actually unavoidable, so those are the things that we can't really get away with, but what we can is what we should do. Yes, late night sleeping can affect fertility because your hormone levels get dysregulated. There is a circadian rhythm that is followed in the body naturally. So, when you sleep late or when you're doing night shifts over a prolonged period of time, it gets affected and your hormones get disrupted, and that's how you can become infertile. Thank you.